Welcome to the Life After Whipple Project. I'm Greg Adams, a pancreatic cancer survivor and current team leader. Shortly after I got my diagnosis, I was scheduled for a dental cleaning with my local dentist. I told him about my diagnosis and impending chemotherapy sessions. His normally cheery demeanor vanished as he pulled up a chair and said, "Greg, I've had hundreds of patients go through chemotherapy. All of them lost some of their teeth, and some of them lost all of their teeth." But he went on to say that it is not all bad news. There are many things you can do to prevent the damage that chemo and other cancer treatments do to your dental health. Well, Dr. Vitrano, I'm going to let you explain to our audience what those things are.
Hi, thanks. Just like Greg said, I am a general dentist from the Metro Detroit area. There's a local hospital down the road from us, and we've got a few patients that are in the cardiology department, and we've just worked a little bit hand in hand with them through the years in helping them just have a better dental knowledge, because unfortunately there isn't really a big dental knowledge for cancer patients in general. It's almost like, hey, we're going to treat the cancer and we're going to try to save your life, which is important and which is the main focus. But a lot of times what we've seen through the years, when patients are finished with their treatment and maybe get a pretty good clean bill of health, they realize their mouth is just it's a train wreck. So this will just be some pointers kind of focusing on just Whipple, pancreatic cancer, but just it kind of applies across the board just to how to just take care of the teeth a little bit better so you hopefully don't have those problems. So like I said, we're going to just talk about some of the oral complications that are associated with cancer treatments. We'll kind of keep it, more so to Whipple, but like I said, it's a general, it can apply to all cancers. So one of the biggest problems that we see with cancer patients undergoing cancer therapy is some type of mouth complication. About a third of the patients undergoing treatment will have some type of a mouth complication. Those complications could be just difficulty talking, eating, chewing, swallowing to the point where their whole mouth is like broken out almost in a rash and ulcerations, and it's just extremely painful. But oral complications occur in about 40% of patients who receive chemotherapy, and 80% of patients who have had some stem cell transplants. But it's pretty common. So like I said, we're going to focus really just on Whipple and pancreatic cancer, but like I said, it's pretty broad across all the cancers. So understanding how the treatment affects the oral health is kind of knowing what chemotherapy drugs do, and chemotherapy drugs will slow down or stop fast-growing cells, such as cancer cells. They also prevent the growth of normal cells in the mouth, because in our mouth, the soft tissue is one of those normal cells in the body that is a fast-growing cell. It replicates pretty quickly in the mouth, which is good for healing, but it's also bad when you're taking these chemotherapy drugs, because it can have a pretty bad effect on the mucosa, soft tissue in the mouth. The chemotherapy may also cause a decrease in the white blood cells, which causes a problem for fighting infections. And then the chemotherapy drugs can also sort of mess up that healthy balance of bacteria in the mouth. And I'm sure a lot of people have heard that the mouth is dirty, over 400 or 500 types of bacteria in the mouth. The good news is most of them just live, symbiotically with us. There's only a couple that cause bacteria, a couple that cause bad mouth, and a couple that cause, some periodontal disease, gingivitis. But unfortunately, chemotherapy drugs can cause quite a few problems in the mouth. So again, some of those common complications from the chemotherapy drugs are mouth sores, bleeding, dry mouth, tooth decay and gum disease, infection, changes in taste, a little bit of neurotoxicity, malnutrition, dehydration. So, um, kind of taking that back now to Whipple patients. So, through my conversations with Greg through the years and understanding his condition, it is my understanding now that these Whipple patients are at a higher risk for osteoporosis. Um, and that can cause, weakening of the bone, obviously, is a big problem. And there can be some dental complications with that when we look at the big picture. So one of the best ways to treat this osteoporosis or osteopenia that a lot of people have, and this isn't just Whipple patients, this can be women dealing with maybe some bone loss, osteoporosis problems later in life. This can be any other cancer patient, but there is a drug class called bisphosphonates that kind of save the day for those patients, but they have a lot of side effects. So bisphosphonate drugs are a drug class that help prevent bone loss. They're kind of known as a bone strengthening or bone hardening drug, and they basically reduce bone loss over time. But again, like I said, they do have some major side effects, and they do have a lot of major side effects in the mouth and for dentists and oral surgeons to deal with a little later down the road. So the biggest oral complication that these bisphosphonates or bone strengthening drugs have is they can cause osteonecrosis of the jaw, which is basically the bone dies. When the bone dies, it can cause tooth loss, pain, sores, infection, but the biggest thing is tooth loss. Really, that's the biggest complication. Not necessarily tooth loss, because let's say you had an infection and you had a bad tooth and you had that tooth pulled and you're thinking, hey, I'm good now. The issue is this osteonecrosis of the jaw, because that extraction site does not heal. You could potentially lose 2, 3, 4 more teeth around that area. If you're not careful, it can make orthodontic movement more difficult. We have a lot of patients now, middle age, 30s, 40s, 50s, 60s that are doing Invisalign or clear aligner treatment. And sometimes these drugs can make it harder for the teeth to move and your Invisalign treatment to work. Some patients have complications with implant placement. It can make it more difficult. And then dental extractions are the big one. For some patients that have been on high concentrations and along many years of these bisphosphonate drugs, dental extractions aren't recommended. And you just kind of have to take them case by case, and you have to weigh, what the possible outcome might be if you are having extractions done. So one of the best ways to prevent that osteonecrosis of the jaw is to have good oral hygiene at home, which is, 365 days a year, regular dental visits. We can't stress that enough, because unfortunately, even with really good home care, if you're not getting x-rays about every 1 to 2 years, or just, letting the dentist and the hygienist look around, a lot of things can be missed. You want to try to avoid dental extractions if possible. Mild cases can be treated with antibiotics, topical gels, and oral rinses, but more severe cases can require that surgical debridement and sometimes actually cutting out a section of the jaw. There's been a little bit of research that hyperbaric oxygen therapy can be helpful depending on the case. So, but the biggest thing is really just prevention. Trying to not get into that predicament in the first place with having to have teeth extracted. So again, and this is kind of that broad topic of cancer in general, but it applies for Whipple patients here too, across the board. But things that we can just do to help our teeth along, and the big ones are brushing the teeth and the gums 2 to 3 times a day, making sure we're using a fluoride toothpaste, flossing at least once a day, using some over-the-counter antibacterial mouth rinses that, help prevent gum disease, bad breath, and kind of keep the bacteria in check. If you are experiencing dry mouth symptoms, there's some over-the-counter dry mouth products. Any type of lip care products, if you're suffering from, dry, cracked lips, keeping your oral appliances clean. So if you have dentures or partials, or if you're doing Invisalign, or you wear a bite guard for grinding, or you have a sleep apnea appliance, just keeping those clean so you're not bringing any more bacteria into the mouth. And then obviously the last one, which really, unfortunately, it seems like we see a lot of patients just as they're going through their cancer treatment, they tend to put the dentist and their teeth on the back burner until maybe treatment is done or close to done. But going to the dentist is huge because they're going to find something. And if they can find it when it's a small problem, they can fix it hopefully with a small fix. And then we're not having to talk about extractions or that osteonecrosis of the jaw. Diet plays a big role. I mean, I know during cancer treatment, you got to eat and you need nourishment, but obviously there are some foods that cause problems. Healthier foods that are easy to chew, easy to swallow are important. High protein foods, highly refined, high sugar, those are going to get you into problems with decay, which could lead to having to have teeth pulled. If you are suffering from some of those mouth sores, avoiding hot, spicy, acidic, really crunchy foods is probably recommended because it's just going to make the mouth sores worse. Again, sugary foods are not good for the teeth, big time cavity cause. Alcohol and tobacco products, same thing. It's just the alcohol is going to dry out the tissue. Tobacco causes some tissue changes. So if you're already dealing with some of those mouth sores and the tissue's raw and angry in the mouth, alcohol and tobacco products aren't going to help. Drinking a lot of water is helpful. Sucking on ice chips kind of helps to prevent dryness. Sugarless gum or sugarless hard candies, again, will help. And sometimes there's some prescription saliva substitutes that doctors can offer, or just over-the-counter dry mouth products that can be helpful for just that kind of soothing effect of the tissue if it is really sore. And just kind of jumping to the next thing on basically how to prevent problems, future, how can we stay away from major dental problems. And even though the American Dental Association says, and most dentists will tell you, you should have your teeth cleaned about every 6 months. Some patients, especially when they're undergoing cancer treatment or other types of therapies, could benefit from getting their teeth cleaned every 3 to 4 months. There are some prescription toothpaste and mouth rinses on the market that offer a little more fluoride or a little better of a antibacterial effect that you could get from your dentist. You could do in-office fluoride treatments. I know they kind of stop when they're kids, but believe it or not, I mean, I could make the argument that our over 65 population could benefit from fluoride treatments. And there are actually some dental insurances now that are paying for once a year fluoride treatments on the retiree kind of over 65 population, which is a great idea. You can have take-home fluoride trays made that's basically like a bleaching tray, but you're going to put some fluoride toothpaste in there and just wear them a little bit longer. So you get that effect from the fluoride to remineralize and harden the teeth to make them less susceptible to cavities. Electric toothbrush is another good thing that you can use at home. Water flosser, water pick is another one. And then, any other products that are recommended from your dental professional team, they're usually, they're recommending them because they work. That's the bottom line. They're not trying to sell you something. But usually what they're recommending is just to really try to help prevent those major future problems from occurring. So talking about some of the products, we'll kind of go through them here a little bit, more in detail, just a tiny bit. But Our saliva is the body's own natural defense system for preventing decay and major problems in the mouth. Our saliva contains calcium and phosphate and fluoride, and they really help to basically remineralize the surface, that outer surface of the tooth during those events from acid and sugar and food and drink and those types of things. So saliva will remineralize the tooth. It keeps the mouth coated, it keeps it happy, but certain classes of medications, even over-the-counter supplements, Tylenol, Motrin, cancer drugs can all cause a decrease in salivary flow. So there's certain things that we um, try to use to help combat that. One of them is this MI paste. MI paste is a kind of a one of a kind product. It's not fluoride. It's got the fancy term recaldent, which is, I believe, in Trident gum, but it basically delivers calcium and phosphate to the surface of the tooth, and it really helps to remineralize the tooth surface. Helps with sensitivity. So for patients that are nervous about using fluoride, which there should be, you shouldn't be nervous. Just regular over-the-counter fluoride toothpaste is very safe. This is something that you can get that can be helpful from a remineralization standpoint, and then to help supplement the saliva with those extra calcium and phosphate supplements. And then the fluoride toothpaste and mouth rinses, like the Act, you can get over the counter. That's really effective. It's got a low dose of fluoride. It's great for daily use when you're on the go. The Sensodyne toothpaste is another one that has potassium nitrate in it, which helps with basically if your teeth are sensitive. Again, just standard fluoride. The prescription, the code name or the brand name for that is the Colgate brand. It's called Prevident. That's kind of the big one that a lot of dentists use. It's a prescription strength because it has extra fluoride in it. So for the patients that maybe have a really high history of dental decay or have a lot of problems with tooth sensitivity, the Prevident toothpaste is going to be really helpful for them because it has that little bit of extra fluoride in there that's going to help with remineralization and sensitivity. Dry mouth products, all over the counter. You can get these at drugstores and Amazon and stuff like that. Unfortunately, they're just not that effective. They work really good for a short amount of time. That dry mouth gel you can get on Amazon. The Act dry mouth lozenges are pretty good. You can get those at drugstores locally or Amazon. The Biotine products, from most of what my patients have told me, are kind of hit or miss. They love the gel the best. The spray, they kind of say, doesn't seem to last very long. In the rinse, they see no really major difference from any other rinse. But the Biotine dry mouth gel, the GC dry mouth gel, and those lozenges do work pretty well for a lot of patients that are maybe suffering from some dry mouth symptoms. The antibacterial rinses, you can get Listerine over the counter. You can get Peroxyl over the counter. Peroxyl is a hydrogen peroxide based rinse. Really good to use, doesn't have alcohol in it. Listerine, sometimes for a lot of patients, it burns because it has a high alcohol content. So sometimes patients don't want to use the Listerine. And the Periodex is a prescription antibacterial rinse. So that's something that a lot of oral surgeons or dentists will prescribe after some extractions when they want something that's just going to be a little more effective than the Peroxyl and Listerine. But the Peroxyl and Listerine are great everyday rinses. The Periodex, the prescription one, is something that usually is just more so prescribed after extractions or when the patient has, maybe signs of more infection in the mouth that we need something a little bit stronger that actually has a antimicrobial component to it. A water picker, a water flosser, again, there's research out there that will tell you that these are more effective than flossing, and they are pretty effective, especially for patients that have crowns and bridges and implants in their mouth. If they're water picking or using a water flosser and flossing on a daily basis, they're going to be really ahead of the game. The nice thing about these water picks or water flossers, they come in different sizes. You can kind of get the old school one that kind of has the tank and the reservoir that sits on the nightstand. That one's a little more effective, especially if the patient has some arthritis or maybe their manual dexterity is not that good. The wand is lightweight, so that one on the left there is going to be easier for that patient that has some issues with dexterity or maybe hand arthritis or can't lift up something that heavy. The one on the right, the black one, the water flosser, that's a portable not battery operated, rechargeable. It's nice because you can take it with you. It has it's much smaller. You can store it under the cabinet in the bathroom. The reservoir is not as big, but you just kind of fill it up when you're on the go. The problem is that can be a little heavy. So sometimes patients with some arthritis or hand issues might not be able to hold that one up. But that jet of water in those tanks, you can put a little bit of hydrogen peroxide in there. You can put a little bit of Listerine in there, and then you can kind of shoot that jet around the teeth, and you're going to get a lot more plaque and bacteria away with compared to just flossing alone. But if you're flossing and water picking, you're really getting a lot of the bacteria, a lot of the calculus, well, not so much the calculus, but the plaques, the soft plaques, removing that so it doesn't turn into calculus and bigger problems, later down the road. Same thing, electric toothbrushes. The research shows that the electric toothbrushes are much more effective than the manual toothbrushes. Lots of them on the market. You can get the Oral-B and the Sonicare are probably the top two. But again, you go on Amazon and you're going to see a lot of them that are, pretty effective, that are highly rated. And again, the research supports that those are going to be more effective in removing stain, bacteria, and those softer plaques in the mouth than just a manual toothbrush. So, but they have to be rechargeable. The battery operated ones really aren't that much more effective, where we're putting in a couple AA batteries as opposed to the ones that are, rechargeable battery operated. And you've got to change the heads on these. I know sometimes patients get an electric toothbrush and then they leave the head on for too long, and then it's just not very effective at all. And the replacement heads, depending on the toothbrush, but they should be changed about every 2 to 3 months at least, so you're getting the maximum effect out of that toothbrush. And the last one is just go to the dentist. You gotta keep going to the dentist, because they're gonna take some X-rays, they're gonna do an exam, the hygienist is gonna clean the teeth, they're gonna remove those harder calculus and the buildup that you can't get off with just your normal home care. You could have the best home care. You could use all those products above. You could water pick, you could floss, use an electric toothbrush, but you're still not going to get those harder calculus, and you're not going to get the stuff that's hiding under the gum tissue out of there. And then same thing with the X-rays. Your teeth could look really, really, really healthy from the surface, but I can't tell you how many times we've taken X-rays and kind of looked under the surface in the bone, and we see maybe an infected tooth or a big cavity that nobody knew they had. So going on a regular basis, getting your X-rays on a regular basis could save you a lot of problems, moving down the road. So you can avoid those major complications with like the osteonecrosis of the jawbone. And that is it. So that is everything that I had to say today. Again, back just kind of one more point to the osteonecrosis. It is not uncommon where we have had patients that we have actually sent them over to the root canal specialists because they were not a good candidate for having their tooth taken out. That they did, it's kind of a what's the word I'm looking for? It's not normal. Most of the time you have a root canal done because we're doing a root canal on a tooth that we want to save the tooth to maybe put a crown on it and keep the tooth in the mouth. But in a situation like this, we sometimes send patients over to the root canal specialist and we have them do a root canal just to avoid the extraction. So that is an option too, where you can have some root canals done and we kind of just cut the tooth off at the level of the bone and put a little filling over it to basically prevent the need for an extraction. But that's in extreme situations. Most oral surgeons will talk to the patient about the pros and cons of extraction versus non-extraction, what the complications are, and manage the complications pretty well. So